ITV News has learned that hundreds of NHS mental health patients in England have killed people in recent years. Research carried out by the charity 100 Families and shared exclusively with ITV News found that an average of 65 mentally ill people carried out killings each year. Grace O'Malley Kumar was one of 3 people killed by a man with schizophrenia in Nottingham in 2023. Last month, an independent report exposed a series of NHS failures in the killer's treatment before the attacks. I'm joined now by Grace's father, Dr. Sanjoy Kumar. Thank you very much for speaking to us today. What is your reaction to these findings?
Thank you for having me, Nina. Nina, these are dreadful, totally avoidable deaths. We are seeking a meeting with Wes Streeting to go through the report. Certainly, the serious case review in the case of the Nottingham attacks was totally inadequate at drilling down as to who was accountable for these deaths. The reason these deaths happen is because after every one of these episodes, a serious case review takes place in the NHS, but it doesn't hold anyone accountable. The only way to change it is to hold psychiatrists accountable, a team accountable, people who placed the patient under section, people who released the person too early, people who didn't give the right treatment, people who didn't listen to the victim's family or even the perpetrator's family. And that is what we have found in our case. And we'll be putting that to Wes Streeting. We've asked for a meeting to see him in the next few days and to say to him that these avoidable deaths, and they are completely avoidable, we would like to reduce them to zero. That's our mission now. We have lost our beautiful and brave daughter, Gracie, and our mission now is to reduce these deaths across the country to an absolute zero. It is the mental health trusts who are not listening to the findings of the serious case reviews, and the serious case reviews are not drilling down deep enough. So just to give you an example, if you're a surgeon and you get something wrong in an operation, you are held accountable. But if you're a psychiatrist and you get something wrong and you let someone seriously mentally ill onto the streets without doing a decent safety check, then you are not found accountable. We don't understand how that works. You have to take accountability for your actions as a doctor. And that's how we end this series of murders every year.
I completely understand what you're saying and your fight and right to fight for accountability. Is it realistic when we're talking about mental health to look to a future where there are 0 deaths, because no patient can be monitored 24 hours a day, 7 days a week? Some people, unfortunately, are going to result, presumably, in somebody else's death.
Nina, if you look at these case reviews, you always find that there is something that has gone wrong. Always find. It is the people who carry out the serious case reviews who have this lethargy of not finding what has gone wrong. You have to have the willpower to drill right to the bottom, and you will always find that something has gone wrong. A risk assessment hasn't been done. The patient hasn't been given the right medication. These are deaths. If you have other parts of medicine, like surgeons, hardworking doctors that are bringing their cases to a zero where there is harm caused, why shouldn't psychiatrists? And every case review will tell you that something has gone wrong somewhere.
Yeah, but you want parity with physical and mental health on this very, very important issue. Look, we know, and I'm sure you know, that Wes Streeting, who you are calling for a meeting with, has seen these findings. He's called them horrifying. He's also said that under his watch, the services, mental health services, are being watched by like a hawk, and that practices have improved. In your experience as a doctor, if and when you refer patients to mental health services, in the time that Labour has been in power, have you seen any sense of even slight improvements in mental health services?
Can I tell you, I have to say that Wes Streeting has been very helpful and very useful. And having met him previously, he definitely wants these to reduce, and he has the willpower, and we have the confidence in him to do it. He's already brought enormous changes to the NHS, which have been positive. We would like to work with him to bring these to zero, and I do have the confidence that he can. Unfortunately, though, a very relevant question that you have asked, as a health practitioner, as a GP, we are still getting calls from mental health services saying that a patient hasn't taken their medication for a year Could you do something about it? I'd like to ask mental health services, what do you think a GP can do? We are a reactive service. We have people who are coming into our surgeries every day who are ill, who we try and fix. But we haven't got the resources to go running after mental health patients. It's their job. And mental health teams constantly are not doing their work. They are not chasing up people who go off their radar. Those are the people who are responsible for monitoring these patients, and they should, but they don't.
As a doctor, your wife is also a doctor. Have you had any reaction from colleagues within mental health services about what you're calling for, this accountability and this parity?
Absolutely, there are good psychiatrists there who say that you are absolutely right. Psychiatrists, the majority of psychiatrists in our country are very good, hardworking psychiatrists. They do the relevant risk assessments, they give the right medication. But then there are psychiatrists who are put under pressure by managers to discharge patients, and they shouldn't be, because a manager has nothing to do with medicine. And if someone shouldn't be discharged, they should not be discharged just because of the pressure of a manager. And then you have psychiatrists who are just bone lazy, who just let people out, like in our case. At the end of the day, they couldn't actually engage with Valdo Calacane, so just simply discharge him to the community. And we would like to know who this doctor is. But the National Health, NHS England review is refusing to identify who this doctor is. Now, how does that work? If that was a surgeon, again, as I said, who had missed something in an operation, he'd be named immediately. But because it's a psychiatrist who just discharged someone because they couldn't get hold of them and let him, out in the community to commit these violent crimes, it's fine for them not to be named. I'm sorry, but that's ridiculous. That's a double standard in medicine, and that can't carry on. And that is the only way we would bring these deaths to zero, when people feel the pressure on their backs to do the right thing by their patients.
What about the pressure on mental health services themselves? We know going in to the pandemic, there was a crisis in mental health. That's been exacerbated by it, and it's continued ever since. Are you calling for anything in terms of solutions to that people are struggling with, the sheer numbers of people coming through their doors right now? And as a GP, you must see that.
Nina, as a doctor, there hasn't been a time where the NHS hasn't been under pressure. But I tell you what, all good doctors wake up every day and they do their jobs under pressure. Just to say that is a cop-out. We have worked under pressure for donkey's years. Since I qualified, I've been working under pressure. I've been in the NHS for coming up to 25, 30 years. There isn't a time when we haven't worked under pressure. For people to just say we've had pressure, every doctor in the NHS has worked under pressure. It is a total cop-out to say. It doesn't stop you doing your job properly. You have the pressure as a doctor, but do your job properly. We all do.
You obviously have a right to fight for this accountability, and everyone understands that. Is there any risk in talking about the state of mental health services and these patients that do go out and kill, when there are teams and doctors charged with making sure they are safe for themselves and for the rest of us, that people will start to demonize people who are seriously ill with some serious mental health problems?
Nina, it's not about demonization, it's about people doing their jobs. At the end of the day, you get paid to do a job, do your job. And in all of these cases, you will see that someone in the mental health team has simply not done their jobs. I'm willing to bet with you today, you look into all of these serious case reviews, in it, you will find someone has not done their job. It is as simple as that. I tell you what, start doing your jobs.
Really clear message. We know you've taken that message to Downing Street. Have you got anything you'd like to say to the Prime Minister today, given the findings that we've shared with you?
Please continue helping us the way you have. We are bringing real change. And I think with our case, there is a really, really good chance that we are going to reduce mental health crimes and homicides to as close to zero as possible. Please help us and aid us in our fight. And all we want is as much help as you have offered us already. Please continue to do so. And it is our mission to bring these homicides, these dreadful, dreadful homicides, to zero.
I just want to end this interview by giving you a chance to talk about the foundation that you and the family have set up in Grace's name. It screams joy, achievement, possibility. Tell us about the progress that foundation is making and the achievements it's already succeeded in providing for people.
Grace was a beautiful 19-year-old medical student. She was living her dream in Nottingham. She was studying medicine and playing hockey at a high level. It represented her country at every level she could, her county at cricket. She was patriotic. She took part in the COVID vaccine program. She gave so much to her country in 19 years. I can't begin to tell you. What we would like is if Grace could be there as an example to other 19-year-old girls of, rich empowerment of how someone, her age should be and behave and contribute to their country. They should be like her in broad strokes. And her foundation very much creates opportunities for underprivileged young girls to get into sport and to get into a life that she had, because she was completely inclusive. And one thing she hated was anyone to be excluded at sport, at school. And what we would like to do is, in her name, show that every young girl in her country should aspire to be like this beautiful young lady who was so brave, so beautiful. She didn't leave the side of her friend. She paid the ultimate price. She would never, ever abandon a friend, and that's what she stood for.
Yeah, your key message of the foundation, be more Grace. Let's hope a lot of people listen to that. Dr. Kumar, a real pleasure to talk to you. Thank you very much for speaking to us.
Thank you for having me.
Thank you.
Thank you very much for having me.